President Trump was scheduled to meet with the 4 congressional leaders this afternoon. The goal? To dislodge a standoff that would shut down the federal government on midnight Wednesday. As I record this, no word yet on what happened. But the biggest sticking point, Democrats want to extend Medicaid healthcare subsidies. Republicans have wanted to kill them for a while, and they're about to expire. It's high stakes. Many North Country residents stand to pay way more for their health care. That's today's story of the day.
Support for Story of the Day comes from the Wild Center in Tupper Lake, dedicated to strengthening visitors' connections to the natural world. More at wildcenter.org.
Hey, I'm David Sommerstein. It's Monday, September 29th. First up, the Newton Falls paper mill caught on fire yesterday and is believed to be mostly destroyed. It was a major employer in southern St. Lawrence County for decades. Our news intern, Richard Haller, reports.
According to multiple news reports, local firefighters responded to the blaze Sunday evening. Video shows the mill engulfed in flames with black smoke billowing out. Local fire departments worked to contain the fire into the night. WWNY-TV reported they were still putting out hotspots on Monday. Leroy Peets, a longtime employee at the mill, heard about it from a friend in the fire department.
It's been destroyed, let's put it that way. The only thing left was where you could walk into it, apparently, was the office.
The mill was once the largest employer for miles around. It opened in 1894, reached its peak in the 70s, and then underwent several openings and shutdowns before closing permanently in 2011. Pete says he hopes the fire brings attention to the lost industries and lack of jobs in southern St. Lawrence County.
We want something to happen here in Newton Falls.
The cause of the fire is unknown right now. WWNY-TV reports that the property has had issues with squatters trespassing. For North Country Public Radio, I'm Richard Haller in Canton.
If you file taxes in New York, there's a good chance a check will soon be hitting your mailbox. John Campbell reports for the New York Public News Network.
Governor Kathy Hochul's administration started mailing out millions of checks worth up to $400 each. It's part of a $2 billion initiative in this year's state budget. The governor says the checks will hit mailboxes in batches throughout October and November.
So you'll have it just in time for your holiday shopping, okay? So I think that's a big win.
Hochul is calling them inflation refund checks, and they'll go to joint filers who made less than $300,000 in 2023 or individual filers who made less than $150,000. In Albany, I'm John Campbell for the New York Public News Network.
In just a few months, many lower and middle-income families could start paying a lot more for insurance. That's because federal health care subsidies are set to expire at the end of this year. And the Republican-controlled Congress says it doesn't plan to extend them. It's become a key point of contention in the looming government shutdown, with Democrats insisting the subsidies be extended before they'll vote for a short-term funding extension. Amy Feiereisel reports on what the loss of the subsidies would mean for New York and the North Country.
Many people have never heard of the Affordable Care Act subsidies, even if they use them. They were originally created as part of Obamacare in 2012. They helped people pay for insurance who made too much to qualify for Medicaid, but made less than 4 times the federal poverty level. That means individuals making up to $60,000 each year. Health insurance for that person can cost around $12,000 a year.
$12,000 out of $60,000 is impossible, especially in a country in which 40% of the people do not have $500 to meet an emergency car or medical expense.
That's Chris Hoy, a recently retired physician who's lived and worked in northern New York for over 3 decades. His last job was with the Hudson Headwaters Health Network Clinic in Queensbury.
The tax credits became the way of allowing people to afford health care.
Especially small business owners, their employees, and people who work multiple jobs. Then the subsidies really ramped up when they were expanded in 2021 under the American Rescue Plan. That got another 12 million Americans on health insurance. And Hoy says it helped get New York's uninsured rate down to a staggeringly low 5%.
finally arriving at something that essentially is universal health care for people in New York State.
But here's the thing. Most people don't know they're getting an Affordable Care Act subsidy. And that's because they're not labeled as such, says Hoy. When you search for insurance through the New York marketplace, you put in information like where you live and your income, and it gives you choices, none of which have a big red sign saying Medicaid.
The vast majority of people do not know that the marketplace is Medicaid. They don't know that the essential plan is Medicaid.
But that's exactly what Republicans see as the problem, that Medicaid has gotten too big. They say it needs to revert back to its original mission of providing insurance for only the very poor and the disabled. Cutting Medicaid back, including the expanded subsidies, was a central part of President Trump's One Big Beautiful Bill Act. Elise Stefanik, the North Country's congressional representative, has said the cuts will reduce waste, fraud, and abuse in the Medicaid system, and that, quote, Republicans want to strengthen and secure Medicaid for eligible citizens, end quote. Democrats, like New York Senator Chuck Schumer, say the Affordable Care Act subsidies play a crucial role in the U.S. healthcare system. Without them, he says care will be inaccessible to many lower and middle-income families.
And if you don't extend the Obamacare tax credits, people's premiums are going to go up $400 or $500 a month, and they're going to start learning about that when they get the notices in October.
The New York State Department of Health says the subsidies support almost 2 million New Yorkers through marketplace plans and the state essential plan. If they expire, it estimates that average premiums statewide will rise by nearly 40%. That looks like a couple paying about $250 more per month for their insurance.
Which is $3,000 annually. That's a big chunk.
Duncan Ryan Mann is an economics professor at SUNY Empire. He's been studying and teaching healthcare policy for over 40 years. He says the impacts of those raised premiums will be people giving up their insurance.
People have to pay a higher price for health insurance, and that's going to discourage people from buying it.
Especially younger, healthier people willing to risk it. Ryan Mann says that leads to something called adverse selection.
People that are less likely to need the insurance coverage will tend to opt out versus those people that need the insurance coverage will keep it. So on average, the cost to those insurers is going to go up.
Insurers then pass that cost on in the form of even higher monthly payments for everyone else. Chris Hoy, the former Queensberry physician, is now a member of the Healthcare Coalition for the North Country. That group formed this spring with a mission of preserving Medicaid in the region, where a third of the population depends on it. Hoy says as people lose their subsidies, and some then drop their insurance, that will stress local hospitals because uninsured people don't seek primary or preventative health care.
By the time it gets bad enough, they end up going and have a much more advanced state of disease and suddenly end up in an emergency situation and go to the emergency room. They have no insurance. The hospital is left with a great deal of uncompensated care.
Hoy says one of the coalition's greatest concerns is that Medicaid reductions, including the elimination of the Affordable Care Act subsidies, will squeeze out the North Country's smaller critical access hospitals, of which there are currently 8.
Those 8 hospitals, they're highly dependent on Medicaid. And they're likely going to close or going to cut services or become urgent care centers.
Democrats have made the Affordable Care Act subsidies a focal point in recent weeks in the potential government shutdown. That will start tomorrow if a deal hasn't been reached. But another deadline is also looming, November 1st, when open enrollment begins for insurance plans. With the subsidies scheduled to expire, many lower and middle-income people will be in for some hefty sticker shock. Amy Feiereisel, North Country Public Radio.
We have more news all the time on our website, ncpr.org. Music today by Christopher Watts and Danny Thomas, both of Canton. I'm David Summerstein, North Country Public Radio.